This talk is an overview of anxiety disorder diagnoses. In this talk, I'll review the diagnoses listed in the Anxiety Disorders chapter of the DSM-5 with mnemonics and visual organizers. First, I'll discuss generalized anxiety disorder. The core symptoms of generalized anxiety disorder are many worries and uncontrolled worries. Alongside these core symptoms, the other symptoms of generalized anxiety disorder can be remembered with the mnemonic worry, worry, warts, which includes weariness or easy fatigability, annoyed or being easily irritated, restlessness, muscle tension, and sleep impairment. To meet criteria for generalized anxiety disorder, the patient must experience both of the core symptoms plus 3 other symptoms occurring most of the day on the majority of days for 6 months, accompanied by significant distress or functional impairment. You can remember that 3 other symptoms are required by visualizing a triangle, which has 3 points and kind of looks like the A in anxiety. Next, let's discuss how the other anxiety disorders are defined. Recall that most psychiatric disorders in the DSM involve a few common criteria, which are the following. The symptoms are not better explained by another psychiatric disorder, the symptoms are not due to substance use or a medical condition, and the symptoms cause significant distress or functional impairment. To simplify things, when I discuss the anxiety disorders, I won't mention these common criteria. One simple way to further specify a patient's anxiety is by dividing anxiety symptoms into 2 subtypes, cognitive anxiety and somatic anxiety. Cognitive anxiety refers to symptoms occurring in the brain, such as worry and overthinking, whereas somatic anxiety refers to symptoms occurring in the body, such as muscle tension or shortness of breath. When cognitive anxiety becomes very severe, it may manifest as obsessive-compulsive disorder, and when somatic anxiety becomes very severe, it may manifest as panic disorder. In the DSM, obsessive-compulsive disorder is not considered an anxiety disorder. It is instead in a category called obsessive-compulsive and related disorders. I've included it in this organizer due to similarities between the concepts of cognitive anxiety and OCD. OCD is diagnosed when obsessions and/or compulsions are present, and they are associated with functional impairment, significant distress, or are present for more than 1 hour per day. Obsessions are defined as thoughts, urges, or images that are repetitive, feel unwanted, cause anxiety or distress, and the patient attempts to neutralize them, often via compulsions. Compulsions are defined as behaviors or mental acts that are repetitive, feel unavoidable, are performed to prevent anxiety or distress, and are performed due to fear of consequences that are unrealistic or excessive. You can see in this table that there are conceptual similarities between obsessions and compulsions. Panic disorder involves recurrent, unexpected panic attacks that are associated with either concern about more panic attacks in the future or potential consequences of the panic attacks, or maladaptive behavior changes in response to panic attacks, commonly avoidance of situations that are thought to trigger panic attacks. Panic attacks are defined as intense anxiety that reaches a peak within minutes and is associated with at least 4 of the 13 symptoms listed here. To remember the criteria for panic disorder, you can use the mnemonic PANIC. P for rapidly peaking anxiety, A for associated symptoms, N for intense anxiety, I for inexplicable or unexpected, and C for concern about future panic attacks or change in behavior due to panic attacks. To conclude, I'd like to briefly touch on the other anxiety disorders in the DSM, which can be thought of as specific anxiety in contrast to generalized anxiety. The first 2 are anxiety disorders that are most commonly seen in children: separation anxiety disorder, which involves anxiety around separation from important attachment figures, such as caregivers, and selective mutism, which involves failure to speak in specific social situations. Next is social anxiety disorder, which refers to anxiety specifically about social situations. This usually involves fear of negative evaluation or judgment in social situations. A specific phobia involves anxiety about a specific situation, such as heights or spiders. The anxiety is out of proportion to the actual threat posed by the situation, and the situation is therefore avoided. Finally, agoraphobia refers to anxiety that occurs within wide open or tightly enclosed spaces, usually due to a fear that escape from the situation will be difficult. That's the end of this talk. I hope this simplification makes it easy to remember the anxiety disorders. Thank you.